Oh my Lord.
Exactly.
Wait a minute.
Our patient today is a 74-year-old male. He's got a serious condition. As recently as 5 to 10 years ago, the typical life expectation for someone with a diagnosis of congestive heart failure was measured in months.
That was definitely my lowest point, and that came on pretty suddenly. I've declined in ways that I don't like, and I recognize that it's going to get worse if I don't do something serious. Yeah, my name is Hobie. I live here in Dallas, Texas.
He is knowledgeable. He learns about everything. But when it comes to doing, is that what I get kind of frustrated with him because he doesn't do it.
We've got to figure out what's going on. Is he seeing this as a totally terminal illness and he can't get any better?
The death of his dad when he was 50 got him back to be very healthy, very everything. And all his two brothers, they died young. So he went to a period of 50s and 60s that he was really scared. But then I guess he reached 70 and they said, well, I got to 70. I don't know. He didn't see maybe the urgency.
He felt like he'd outlived his family.
Right.
And that's why we're doing this series. I'm traveling all over the U.S., working with people who need help in their chronic disease. It's good to meet you in person.
Indeed.
Thank you so much for what you're doing.
You bet, you
appreciate
bet.
it.
Glad to.
Hi.
My name is Azucena.
I'm pretty easily distracted by complexity. And it would be very helpful if I could just cut through.
The freezer.
The freezer. We got some good.
Bluebell's a big favorite. 2/3 of a cup has 25 grams of carbohydrate.
And 2/3 of a cup, that's just enough to piss me off. Right? That's my wife's. Mine is already long gone.
Oh, okay.
Well, see, that's the problem. He brings for me the ice cream, but it's gone and I have not even tasted it.
So in the southeastern U.S., we call that getting your wife a hunting dog for Christmas.
Oh, I never heard that.
You ever heard of that?
No, I haven't, but I see the point.
He told our team what he really wanted, his big goal, was to be able to eat more ice cream. Is it his last vestige for something to have fun with?
Oh, what the hell?
You're into high production here. You get the powder, you make a capsule out of it. To Azucena's point, it's like she's struggling, and I'm struggling watching her struggle, thinking he's diddling with supplements, different supplements, and he's not doing the work. TMG?
Yeah.
I won't argue so much. Are you got high homocysteine?
Some. I mean, I want to avoid it.
What's the highest it's been?
I can't tell you. It plays a role more in muscle building. That's what I'm interested in. But you're the expert, of course.
Yeah, I mean, we talked about creatine.
Yeah.
The second thing that I have found that may have some value. We can simplify a lot of this. We're up to it.
Oh, I will be so grateful if you do
good.
that.
Well, you want to just get a big trash can?
Yes.
And methylene blue.
She has
Yeah,
I know everybody's making big things about that.
for a short period of time. The Lauer recommends kind of off and on for about 3 weeks, and then
I know.
you know, I do kind of suspect metabolic, dysfunction. Just my mitochondria probably could use some help.
I'm sure they could use help. We've got better ways of helping.
All right.
no comments from you. I know you can justify every single battle.
He's asking me questions. Well, that's just mostly what's up.
Ginkgo. I mean, these things. Okay, so D3. Yep. Here's the something else we need front.
I got you.
Oh my Lord.
Exactly.
Wait a minute.
So
That's all just, yeah.
Did you see The Sorcerer's Apprentice?
Yes.
Sometimes supplements can even be an addiction. How much do you think you spent on this?
Well, I mean, just on this alone, probably, a couple of thousand.
Probably. I take creatine, and I do add some protein powder to some of the stuff that I do. Hands down, that's not the problem. The problem is stimulating our muscles.
Right. Been in martial arts throughout most of my life, various styles and that sort of thing. I need to get back to that. I need to get in shape so I can get back to that. It's ridiculous, but that's how far I've slid.
When it hits, he will come and he will exercise 3 hours, 4 hours at a time. You know, all that is just
really go at it.
Yes, blown.
But then 2 days later?
3 days later, it's gone. Doesn't do it anymore.
Now let's get a little bit geeky for a second. When you look at Hobie standing there, he looks fine. Maybe a little extra weight around this waist, but nothing that screams cardiac emergency, right? But medicine is full of things that look calm on the outside and are chaotic on the inside. Here's what's actually happening. Hobie has congestive heart failure. In technical terms, that means the myocardium, or the heart muscle, has lost enough pumping efficiency that his heart cannot put out enough blood now. Layer atrial fibrillation on top of that. The electrical signals in the atria, those are the top chambers of the heart. Those signals stop firing in an organized pattern. Instead of a steady squeeze, those chambers start quivering hundreds of times in each minute. The ventricles, those are the big pumping chambers, they receive chaotic signals. That combination exhausts the heart muscle. Fluid can flood the lungs in hours. Dangerous rhythms can stop the heart in seconds. Blood clots from atrial fibrillation can travel to the brain and cause a stroke in minutes. So when I say Hobie's lucky to be here, I mean that. Yes. What's going to click that button? What's going to snap that switch to say, okay, you know, we got to do what we got to do? Is he unaware that as serious as this condition is, you can train out and get a lot better? The vast majority of people with even congestive heart failure improve dramatically with the right exercise and diet. So we've got a lot of work to do.
I'm doing 1 meal a day now. That may be my saving grace. I mean, I'm used to fast.
One meal a day is a very.
Let me say something about that. That 1 meal a day. Yes, but that 1 meal is 4 meals at once.
Tell me about that.
Well, like he will not eat. I mean, cup of coffee in the morning, and then the whole day no eating, and then is whatever we eat, you know, is tons of food in there. Hobie doesn't believe in portions, I think. Okay?
I go off and have a half gallon of ice cream or something ridiculous. How do I get back at it, you know, without having to totally restructure everything? I mean, is there a way to you know, anticipate that?
Even on a low carb or keto diet, you can gain weight. That's an urban myth to say you can eat all you want. You can eat 7,000 calories and still not gain weight. That's not true.
Yeah.
And they've done the research on it. You do get less efficient when you're not eating the mix with carbohydrates plus fats plus proteins.
Right.
But for most of us, it's about 20% inefficiency. For some people, it's 30%. Now, what all that means is if your basal burn, if your calorie burn is 2,000 calories, even if you're totally keto, you can still only eat about 2,400 calories.
Sure. I'm certainly satisfied, but I don't think I go crazy. I mean, I certainly don't go over 2,000 or 2,400 in a single setting.
Hobie's in massive denial. And to me, that's what so many of us are struggling with. There's some basics that we know that we need to do. We need to exercise. We need to stay thin. We need to stay muscular. And if we can't do that, all bets are off. Everything else is worthless. I can't think of a whole lot of other stuff, but I can think of two things. Number one, can we scare him? Does being scared help? Will that motivate him? From my perspective, I do not think you need to be suffering from lack of motivation. I think you need to be saying, okay, I've got 3 options here. One possibility is I continue to live healthy, I'll lose my gut, I'll do the work I need to do. Or Athusena is looking at me in my casket, or even worse, Athusena's managing me in my wheelchair.
Yeah, right.
We don't want either one of those 2 things to happen. I'm not making it up, right?
No, no. I mean,
you
it's,
understand it.
I mean, hell, I'm 74 years old.
I'm just calling it out.
Yeah, hell yeah, hell yeah. I mean, it's hitting home. I mean, it's hitting true. She often complains, or at least points out, that a lot of the times I'll go out of my way to do things for other people that I wouldn't necessarily do for myself. That I'm kind of motivated that way. You know, if the union makes a call and says, show up at this strike, or, you know, some of the friends call and say, we got a demonstration to do, or, you know, whatever. I'll tend to just do that. I'll just tend to drop stuff and shoot and go. But if it's working on me, you know, it's kind of like the sort of, damn, here we go again.
I think we need some bags, like, you know, those big garbage bags. Thank you much. I don't know. Let's keep at least 2 out here, because this is,
All right.
yep, okay.
The thought that it's better to hang on to this stuff than get rid of it, for one thing.
Move on. Yeah.
You know, in the maybe even faint hope that maybe at some point it might do some good.
You know, I take supplements. I remember a few years ago, I had my own trash bags full of supplements that I didn't want to get rid of yet, even after I piled them in the trash bags. I kept them for a few months, and then I realized I'm never using these, and then I was able to throw them out. Bottom line is, again and again, I see this. We do more damage to ourselves worrying about maybe there's something in my environment, something in my diet that's missing or that's creating a problem. I get it, that's all very true, but as a doctor dealing with these things, it's not a supplement deficiency that's killing us. It's a lifestyle deficiency. We need to be able to do the exercise we need to do. We need to be able to push away from the table and not eat so much calories.
Yeah.
Feel where your money's gone.
Yep. Concrete, at least.
Well, that's okay. You know, a big piece of gym equipment would probably cost a lot too, so you can just use it for that. You mentioned early on that you do a form of HIIT or re-HIIT. I want to do those with you.
All right.
So where do you usually do them?
Out on the parking lot burpee. I'm just here, right, out, up, and then jump, right?
Okay.
Pretty simple. All right, ready?
Yep.
And then walk around.
That's pretty good.
I'll come back.
So you do, how many of these do you do?
Maybe 3 or 4.
There you go.
And
you do that twice a week?
yeah.
For you guys, we've been saying HIIT and re-HIIT. So HIIT stands for high intensity interval training. Remember, we've mentioned intensity many times. There are many protocols, but a standard protocol is this: going up to a high level of exertion for 1 minute, and then walking around no exertion or very low exertion for 1 minute. That is one interval. And the standard used to be get 20 intervals in a week. 2 sessions of 10 intervals or 3 sessions of 7 intervals for 21. Research has been clear that you can get a whole lot of this from what we call RE-HIT. That's RE-HIT. RE stands for reduced exertion hit. So that's 20 seconds, going a little bit harder at 20 seconds, and then coming off for 40 seconds to a minute. That's 1 interval. And you only have to do 2 or 3 of those. Now, tonight and tomorrow morning, I'm going to be meeting with Jesus and the rest of the team. We want to get drilled down a lot deeper in terms of what's the best schedule and types of exercises for Hobie. Like I said, he's got a good base, but it's not everything that he needs to be thinking about.
Still, he has some high CRP. Still, he has some insulin resistance, not full-blown diabetes though. And he kept saying us that he had some AFib, but we don't have any recent tests to see where we are with that.
There are certain studies that we don't have because he depends on Medicare, so we've only been able to order the tests that Medicare have been able to pay for.
Correct.
Craving for energy, and he's probably not getting it. He's eating a lot of empty calories, but not nutrition. He's not nourishing his body. He's just providing something to survive, and that's not enough.
He had a supplement list this long, and we just tore that down. I didn't tear it down with enough drama. And he wants to replace that with clarity on his workout. I would also like to replace that with clarity, a clear plan on his diet as well. We understand what probably happened with Hobie's failure in his heart.
Let's assume that what he's telling us is exactly what happened. Let's take it literally. His ejection fraction at one point was 15%. He had an atrial fibrillation, now it's 55%. He had what we call tachycardia-induced cardiomyopathy. And it looks like he didn't even know he had atrial fibrillation. He said, they told me I had atrial fibrillation.
Dr. T, he's a great cardiologist, but not only a cardiologist, he's done thousands of ablations. That's what he does for a living. And he explained to us what probably happened with our patient's heart. He said sometimes when you get into atrial fib, you get too rapid a response from the ventricles. And that's on those occasions when you can get a real drop in function causing heart failure.
You want to protect your brain, period.
Yeah, from stroke.
From stroke.
Right, and he is on Eliquis. We got real confirmation that lifestyle is critical to Hobie right now. And we're going to take that information back to him. I love having Jesus carry my bags. He's always called me the mule forever, but now he's getting to do that.
Hey.
Buenos
dias.
Estás? Buenos dias.
Good to see you, bud.
Muy bien.
Yeah, I'm a little...
You good?
Yeah, I feel it from yesterday. I hope you do too.
No, not much, but I didn't do as many.
He said when he woke up, I'm feeling it. What are you feeling? Bienvenidos.
On my internal team, I have a very good intensivist.
Actually, when we find this purpose in life and actually tackle that part, maybe other aspects and the lifestyle pillars is going to come easier. He will like to take care of himself. He will like to exercise more.
We'll be getting you a book. You may have already read it, Man in Search of Meaning.
No, but I'll give it a shot.
It's a very good book. It was written by a psychiatrist who, in the prison camps at Auschwitz, the concentration camps, and he noticed that people, when they have a purpose in life, challenges regarding motivation go away. And their life,
I can see that.
Their life extends very, very long, whether they have health conditions or not. Why don't you and I go for a walk? I'd like to get into some detail and talk about a few other things. Now, there are 2 things that might be confusing at this point. If Hobie has heart failure, just how bad could it be? Now, here's the key, and you might have picked it up. The atrial fib and flutter for the geeks out there and the cardiologists, when he goes into fib flutter, he also goes into heart failure. He goes from a normal to great 55% ejection fraction down to 15%, which is hardly livable. What do I do for him? Well, if we can keep him out of atrial fib, we keep him out of failure and we keep him healthy. I want you to hear the statistics on this. People with atrial fib, you get the ablation done, you get them doing what they need to do. If they do what they need to do, they make the lifestyle changes, 5 years down the road, they're gonna be 87% are gonna be healthy.
Pretty good odds.
They don't do the lifestyle components, 5 years down the road, 13%. So,
wow.
You know, that sort of hammers in home what you need to be knowing. Your future, and maybe even more importantly, Athesaina's future is in your hands.
Damn, that's pretty stark.
It is. And we'll be there for you.
Cool.
But we're not living with you.
No, I know.
That part's up to you. And as you can see, I'm making Athesaina very aware of this.
Well, that's helpful.
Because I want her to help me too.
Yeah, yeah.
I've got licenses in all 50 states. There's only a couple of dozen doctors in the country, the US, that have that. I could sit at home and make a bunch of money writing scripts for a bunch of people, but that's not going to do people any good. This is what's helping people. And if you'd like for us to come visit you, we're not charging patients to do these visits. Just get the form below, fill it out. I'd love to meet you.
So I'm very excited about this next part of Hobie's plan. This is a glucose monitor. You're able to track your blood sugar for about 14 days. It's not as exact as a fingerprint, but in Hobie's case, what we're gonna do with this, we're gonna be able to track what each type of food he consumes does to his own blood sugar. Anytime your blood sugar goes over 140, you're basically burning your arteries. And this thing is gonna be able to detect that and give you the number with a red signal on it. If we put it too close to the muscle, it's gonna hurt.
Yeah, no.
We don't want that. Some skin, we don't want to touch the muscle. I'm gonna put it a little bit higher, for Hobie's privacy. I'm gonna feel a little bit of pressure. 1, 2, 3. There you go.
Cool. Nothing at all. Pressure, nothing more.
Exactly right. And now you have your phone on you. We need just to activate the sensor. Let's get it prepared.
So can I do it through my...
Yep. It should vibrate.
Okay, got it.
Okay.
Sensor
will be ready in 60 minutes. So now we're gonna do some exercise. And if you're gonna do 5 or 15 minutes of exercise, something quick, I don't want you to feel like you need to go and change. And then at some point you'll feel like, oh, well, I probably should not be doing exercise today. I'm too tired. The clothes are not a barrier. You can do it with your street clothes.
You know, I've been an activist all my life, and that's generally meant putting my body somewhere and being able to function, right? And I've noticed older people kind of dropping out of activism because they can't move anymore. It's very important that I be able to continue, you know, in the struggle.
And go down, down as you can.
Okay.
Back flat.
All right.
And if you need, at some point, you just say, you know what, if I do this too much, I feel like I'm gonna fall. You can grab a chair or something that you can hold on the sides.
Okay.
I don't think you need it, but if you feel like, go ahead.
All right. But I can feel it.
All right.
Yeah, for sure.
If you can do 1 minute, that's fantastic. But we can start 20 seconds, 30 seconds, whatever you tolerate.
Okay.
And I don't know if we have a timer somewhere, but
I should have gotten mine out, but I can.
That's fine. No, you're good. I want you to do as much as you can. And when you say, okay, this is enough, that's fine.
All right,
we're just done. That's good. We're just warming up.
All right.
Perfect.
Good. Yeah, I mean, I can feel it already. I normally do these for a while,
That's
but
good?
that's good too.
Those two,
I mean, they're sort of different.
they are different, but this one is more targeting the quads,
Boy, I can feel it.
which is what we want.
Yeah, okay.
But so that's how your exercise starts every single day. You stretch a little bit,
Neck,
do a wall squat,
shoulders.
and then
True.
back. Don't forget core.
Oh yeah.
Do little rotations. You don't need to do that much, not so aggressive. So let's try this one. Let's see if it works. We're gonna do some chest press. So
Okay.
you put it on these.
Yeah,
Have you done this before?
Oh, I've seen it demonstrated. I do it some on my pad, but yeah.
Let's put it lower. If it's too short, we can use the other one.
No,
I think
I think it's okay.
Okay, let's try it.
We'll
So
see.
you're holding tight. Try to push to the front, and put your hands together. So 1. Open. Don't keep it close. Open. Then front. 2. Good. Open. There. Good. And then there, try to hold it for a second.
Right about here.
Yep. And then go back up. Good. Then go down. Hold it for a second.
It's time under tension.
Good. Let's go up. Great. Fantastic. Well, you're gonna warm up, do the wall squat, and then you do this.
I got you. I don't want to put a lot of burden on my family. And while death would be one thing, what's even worse is long-term disability.
Yeah. I want you to grab this piece of paper and put it on a place that you see it every single day.
Okay.
And it has to be next to this. Because when you see this and you say, okay, what am I gonna do today? I want you to see this and say, I'm gonna do it for her.
Oh. Okay, cool. Yeah, that's neat.
On the last piece of your exercise, I'm putting here, Zumba with Azucena every Saturday. Doesn't matter if you go out or not, but you're gonna do this with her.
The team's been working with Hobie for the past few months, yet he's not progressing the way I want. To be honest, he looks the same. There's no change in his weight. He's got a long list of excuses as to why that is. And he says he understands the implications and the outcome. I really need to speak to him, and let's see if we can get him back on track.
The other side of my life is very political as a rule, and it's been quite disruptive and intense.
You can't help the guys politically if you're at home being a burden on Azucena because you've had a stroke.
Yeah, it's ridiculously paradoxical, but yes, you're absolutely right.
And so you know, Hobie, this comes from a place of both concern and interest from our side for you to succeed beyond the channel.
People will be watching, and I hope they can see you victorious.
Yeah.
Do you want them to see you scrounging around and making a commitment and not doing it?
No. Exactly.
And I saw you doing those burpees.
Yes.
Man, you can do it. The only reason you're not doing it is yourself. It's Hobie getting in the way of Hobie.
That's right. That's right.
I am struggling for anything and everything I can get to get your motivation to latch on to something and make a commitment.
Okay, I will exercise. I'll shoot for 4 o'clock in the afternoon. That's reasonable before I eat, and I fully expect to start dropping 1 pound of fat a week, maybe 2.
You got a deal. We'll continue our part.
All right. Fair enough. I appreciate it.
If what I've shared today resonates with you and you're ready to explore becoming a patient, click the first link below. That's the best place to start. And if you're not quite there yet, but you want to take control of your heart health, download our free heart attack prevention guide. It'll walk you through exactly what to focus on.